Chapter 25.1. Complete the table with words from A, C, D, and E opposite. Noun and adjective. Affect, affective, anxiety, anxious, behavior, behavioral, dementia, demented, disturbance, disturbed, suicide, suicidal. 25.2. Make word combinations using a word from each box. Two words can be used twice. Look at B, C, and E opposite to help. To behavioral, behavioral syndrome, eating disorder, major depression, mental retardation, personality disorder, psychomotor retardation, sleep disturbance, substance abuse. 25.3. Complete the sentence. Look at A, C, D, and E opposite to help you. 1. The way a person behaves is his or her behavioral. A persistent emotional state is a mood. A sudden attack of anxiety is a panic attack. The form of dementia associated with aging is called senile dementia, a disorder which is not associated with pathological changes is functional. An idea which forces a patient to repeat unnecessary actions is a compulsion. 25.4. Which symptoms of depression was this patient suffering from? Look at C opposite to help you. Case 41. A 56-year-old woman present to her general practitioner complaining of increasing tiredness. Over the past few months, she has lost interest. This is the second symptom. Sorry, tiredness is the first. Tiredness. The first symptoms is the first symptom is tiredness, and the second lost interest. In most things, she was sleeping poorly. This is the third symptom, and tended to wake up early, but denied any suicidal tendencies. She was thirsty and was pacing urine more often. She was eating normally and her weight was steady. 26.1. Complete the table with words from A, B, and C opposite. Adjective and noun. Blind, blindness. Conscious, deafness. Dizzy, dizziness, dizziness. Numb, numbness. Lightheaded. Unsteadiness. 26.2. Make word combination using a word from each box. Look at A, B, and C opposite to help you. Double vision, epileptic fit, prodromal symptom, syncopal attack, urinary incontinence, and visual acuity. 26.3. A doctor is trying to determine the cause of love consciousness in a 52-year-old woman. Complete the doctor's questions. Look at C opposite and the table in 26.1 about to help you. Did you lose a vision suddenly or gradually? Did you get a warning of the attack? What are you doing before you pass out? Were you worried or under any stress at the time? Do you feel dizzy or lightheaded before the attack? Do you lose control of your bladder? Did your wife notice any involuntary movements while you were unconscious? 27.1. Complete the table with words from A and B opposite. Noun and adjective. Ascent, ascent, diminution, diminution, diminished, diminished, flaccidity, placid, spacity, spastic, wasting, wasted, wasted. 27.2. A doctor is giving instruction to a patient during examination of the motor system. Identify what the doctor is assessing in each case. Look at A opposite to help you. 1. I'd like you to relax. I'm just going to move your arm up and down. Muscle tone. Can I see your hands? Muscle bulk, and possibly involuntary movements. Now, I'm going to strengthen your arm out. Try to stop me. Can you touch my finger with yours and then touch your nose? Good. Now do it again with your eyes closed. Coordination. 27.3. Complete the sentence. Look at A, B, and C opposite and the table in 27.1 about to help you. 1. A flaccid hand rubs limply to form a right angle with the wrist. Brief reflexes are reflexes that are stronger than normal. Muscle wasting means the muscle is reduced in volume. A tic is a form in involuntary movement. His coordination was poor. He could not perform rapid alternating movements. A reflex hammer is used to test reflexes. When something is involuntary, it is less than normal. 27.4. A patient is brought to A&E in coma. When her name is spoken, she opens her eyes, but she does not answer questions or of instructions. What is her CECS score? I open in 3. Verbal response 1 and motor response 1. 28.1. Complete the table with words from A, B, and C opposite and relate forms. Verb, nouns, and adjectives. Cure, curative. Excuse, excision. Row, rowing. Invade, invasion, invasive. Obstruction, obstructive. Palliation, palliative. Palpate, palpation, palpable. Spreading. Swelling. 28.2. The notes below are about the patient described in the opposite. Use them to put the sentence 1 to 9 in the correct order to make the next paragraph of the case report. Use Appendix 2 on page 20 if you need help with the abbreviations. O OET 37A, grid 6. A smooth firm 3/4 mass in air supraclavicular fossa 3. Knots 1, 2 in diameter, palpable in both axial and inguinal areas 7. Oropharynx nat 2. P 100 mean regular. BP CBS NAD eras NAD 4. Add mass palpable 3 below L custom margin 5. At CNS NAD 1. Examination of the central nervous system was normal. His mouth and throat were normal. There was a smooth firm 3 mass in the right supraclavicular fossa. His cardiovascular and respiratory system were normal. On abdominal examination, there was a mass pupil 3 below the left costal margin. On examination, his temperature was 37.8 grades. There were large lymph nodes in both axial and inguinal areas. His pulse rate was 100, 1000, mean regular, and blood pressure 28.3. Complete the sentence. Look at A, B, and C opposite to help you. Distant spread of tumor cells is known as metastasis. Many symptoms of cancer, such as difficulty swallowing, are due to obstruction. The opposite of painful is painless. A malignant neoplasm is called a cancer. Tumors which do not invade or metastasize are benign. Secondary tumors are those which result from the spread of a primary. If a cure is not possible, palliative treatment should be given. A pulpal liver suggests metastasis. 29.1. Complete the sentence. Look at A, B, and C opposite to help you. 1. A baby that is born a week before the EDD is premature. A termination of pregnancy may be necessary for medical reasons. The first 3 months of pregnancy are known as first trimester. Fetal distress is the first stage of labor is an indication for cesarean section. It was a bridge presentation and delivery was by forceps. A miscarriage is another term for spontaneous abortion. The umbilical cord was wound tightly around the baby's neck and it was unfortunately stillborn. 28.2. Complete the table with words pronoun opposite. Verb and noun. Abort, abortion. Deliver, delivery. Induce, induction. Miscarry, miscarriage. Present, presentation. Terminate, termination. 29.3. Dr. Bennett, an HAO, is presenting a patient at a weekly meeting in the obstetric unit of a hospital. Complete the presentation with the correct forms of verbs from 29.2 above. This is Clara Davis. She came to the antenatal clinic at 9 weeks. In her past obstetric history, she had a pregnancy when she was 18, which was terminal, and another one a year later, which spontaneously aborted. Since then, she has had 3 pregnancies. In the first, the baby was delivered normally at 40 weeks. In the second, she had an induction of labor at 39 weeks because of fetal distress. The third baby present as a bridge and was delivered by cesarean section. 30.1. Make word combination using a word from each box. Look at A and B opposite to have. Blood, stained. Red, sounds. Pleural, rub. Productive, cough. Vocal resonance. 30.2. Rewrite the question using words that are better known to patients. Look at A opposite to help you. Is your cough productive? Do you cough up any phlegm? What color is the sputum? What color is the phlegm? It is ever purulent. It is ever yellow. Have you ever had amyopathitis? Have you noticed any blood in it? Do you suffer from dysphonia? Any problems with your breathing? 30.3. Are the following statements true or false? Give reason for your answer using your medical notes. And and B opposite to have. A patient who has a loose cough produces phlegm. True. Crackles are heard when the airways are narrowed. False. A patient who has non-productive cough produces sputum. False. Wheezes are typical of pleurisy. False. A pleural rub is a sign of asthma. False. 31.1. Complete the description of herpes zoster shingles by replacing the medical words in brackets with ordinary English. Look at A and B opposite to help. Shingles, herpes zoster usually starts with pain and soreness, then red. Spots, micles appear that develop into groups of small blurry vesicles over a particular area on one side of the body. In most patients, new spots. Lesions continue to appear for 3 to 5 days. The small blister vesicles become pallid with pus, pustule, and then form scales rust. In several cases, they're made scarred afterwards. 31.2. Read the description of the rash of rubella and complete the notes. Look at A and B opposite to help you. The spots are scarred pink macules which appear first behind the ears and on the forehead. The rash spreads rapidly first to the trunk and then to the lips. Location and distribution. First behind the ears and on the forehead, then the stomach and limbs. Grouping scattered. Type of lesion, macules. Color, pink. 31.3. Complete the note for the rash in the photograph and suggest a diagnosis. Look at A and B opposite to help you. Location and distribution. Widespread on the chest and the abdomen. Grouping scattered. Type of lesion, small macules with some scales. Color, pink. 31.4. Complete the notes for the lesion in the photograph and suggest a diagnosis. Look at A and B opposite to help you. Location and distribution. Below lateral angle of the left eye. Grouping single. Type of lesion, nodule. Color, pink. 32.1. You read the corresponding medical terms for the ordinary English word and say what kind of force is involved. Look at A opposite to help you. Common word, medical term, and type of force. Bruise, contusion, blunt. Cut, incited, wound, sharp. Raise, abrasion, blood. Scratch, liner, abrasion, blunt. Stab wound, penet, penet, penetrating wound, sharp. Tear, laceration, blunt. 32.2. Choose the correct words to complete the description of the injuries shown in the illustration. Look at A and B opposite to help. There are grazes, scratches or grazes about the left eyebrow and on the left side of the neck. A contusion or laceration to the left side of the lower lip, and tears, cuts, tears of to the left cheek. 32.3. You read a description of the injuries shown in the illustration. Look at A and B opposite and add 32.2 about to help you. There is a laceration on the left shoulder, and I insisted a one in about the left nipple. 32.4. Complete the sentence. Look at A, B, and C opposite to help you. Frequent changes of position are necessary in the immobile patient to prevent the development of a pressure sore. He had several stabs, once in the abdomen from the knife. He was knocked unconscious by a heavy blow to the head. The wounds were only superficial and required no treatment. 33.1. Look at the conversation in A opposite and complete the notes about Mr. Jones. Use medical terms where possible. Frequency and nocturia. Dysuria, hesitancy, stream a little weaker. No incontinence apart from occasional dribbling. 3.2. Match the patient description of their symptoms 1 to 7 with the medical terms A to D. Look at A opposite to help you. I have to pee every half hour or so. Um, Frequency. I get a scalding pain when I pass water. Dysuria. I have to get up several times to pass water at night. Nocturia. I have to rush to go to the toilet. Incontinence. I have trouble getting started. Hesitancy. I can't hold my water. Urgency. I pass some blood in my urine. Hematuria. 33.3. You read the doctor's question from each of the symptoms in 33.2 about look at A opposite to help you. You will need to think of your off question for urgency. Dysuria. Do you have pain when you urinate? Frequency. How often you urinate? Hematuria. How you urinate with blood? Hesitancy. Do you have any trouble getting started? Noctaria. Do you have to get up at night? Urgency. Do you feel an urge to urinate? Incontinence. Do you ever lose control of your bladder? 33.4. Describe the findings of the laboratory report in words. Look at the opposite to help you. There was a trace of blood, a gross proteinuria, and not cost. 34.1. A doctor is talking to a patient during an ophthalmoscopy. Match the underlying expression. She used 1 to 4 two expressions with similar meanings from A opposite, A to D. Right, Mr. Go, because you've been having these headaches, I'm going to have a look at your eyes, particularly the back of your eye, the retina. I'm going to put a couple of drops in your eye, which will make it easier for me to see the retina. After a few minutes, you may find your vision a bit blurry. This will wear off after about an hour. I need to get rid of as much external light as possible. This means closing the blinds. Now, I'd like you to look straight ahead at that clock. This takes a few minutes and your eyes may feel a bit tired, so you can blink if you need to. I don't want to look at me, look at the clock. The examination is done with diamond lights free, a topical hydrating solution. You want to aid dilatation to fix it on a target for 34.2. Complete the instructions. Look at the opposite to have. Warp the cuff around the patient's upper arm. Place the diaphragm over the area to the brachial artery. Raise the patient's arm so that the brachial artery is at the same height as the heart. Close the valve on the pump. pump up the pressure to at least 1,150. Open the valve a little and slowly deflate the cuff while listening and watching the pressure go. The first sound you hear in the flow of blood through the brachial artery, the value of the gauge at that point is the systolic blood pressure. Continue listening while you slowly defeat the cough. The, the diastolic blood pressure is measured when the sound completely disappears. 24.2. Complete the text. Look at C opposite to help you. Phlebotomists are especially trained in taking blood. They are skilled and at puncturing the vein to take a blood sample. The wrist, hand, and foot can be used, but more often a vein in the inner part of the elbow is used. If it is difficult to locate the suitable vein, the patient may be asked to make fist, or a tourniquet may be applied to the upper arm to make the vein more apparent. Afterwards, a dressing is applied and the patient is asked to press gently. This helps to stop the bleeding and prevent bruising. At this site, it is important that specimen tubes are labeled correctly before they are sent to the hematology laboratory, where a full blood count or other investigation will be carried out. Thank you.